Okay, folks, for most of you that suffer from thyroid conditions, you're also suffering from other conditions, and this is a common thread in my office. You may have insulin resistance, where you have blood sugar issues. You may have vertigo, where you get dizzy. You might get sciatica or pain shooting down your leg. You might get neuropathies, insomnia, where you can't sleep through the night. This is also a common problem. Celiac disease. You might have migraine headaches. These are all things that can be happening to you along with your thyroid problem. This is something that I experience and hear all the time. And we look at this, we look at what could be going on. There could be oxygen deficit where your oxygen is decreased, you're not getting it to the brain, you have neurological misfiring. We test these in our office to see if these things are going on. And folks, if you have that, it will impact your condition, your health, and your thyroid problem. There's no question. We look and see if you have metabolic imbalances where, again, there could be blood sugar issues, dysglycemia, cortisol imbalances where your cortisol levels are too high, which is toxic to brain, causing some of your brain fog. That could be contributing to your brain fog. Hormone imbalances, anemia. Folks, if you have an anemia issue going on, iron deficiency, folic acid, B12, you will be fatigued, you will be tired, and you just will be suffering to get through the day, a normal day. So we look at that. Again, we look at the autoimmune attacks, immune imbalance, and of course food sensitivities, which is also real important to look at. And again, all cases, almost 100% of the time of these cases that come into my office, there is a combination of both neurological involvement as well as metabolic involvement. Every person is different with that percentage, but it is common. It's almost every time that have metabolic and neurological issues causing your problem. And we work on that. We look at that. We do all the neurological tests. We do all the metabolic tests in our office here to find out if we can help your problem with your thyroid condition there. That's what makes our office different, as a matter of fact. Instead of just going and looking at a metabolic approach or a neurologist for a neurological approach, we combine the two. That's how we get the results in our office. And looking at these tests, folks, we do the tests that you haven't had done yet. Most of you have not had some of these tests done and need these tests. This is the solution. These are the pieces of the puzzle that are missing in your case. We look at a full thyroid panel. Folks, remember we talked about those 8 different thyroid markers we look at. Have to run those. If you don't have those full 8 thyroid markers, it's questionable. We don't know. How can you really know and assess thyroid function if you don't have those? We look at vitamin D levels, especially those that you suffer from autoimmune disorder, where the vitamin D levels are just at the bottom of the floor, really low. We look at anemia, kidney function. Again, immune panels. We talked about that Th1, Th2 balance. We do an immune system challenge to find out if you have that imbalance, and if you do, we address those issues. Adrenal stress index. We look at cortisol via saliva. It's a saliva test to look at cortisol levels, testosterone, other hormones to see if those are in balance. If your cortisol levels are high, cortisol is toxic to brain, causing brain fog. A lot of you suffer with brain fog, so we want to address those. It could be food sensitivities, and the top 5 food sensitivities are gluten, soy, could be sensitive to yeast, egg, maybe even dairy, the casein. So we look at those. This could be a possible test we do. Finally, we look at a possible stool test to see if you have a chronic bacterial infection, yeast infection. You could have a fungal infection. Even some of you, without even knowing it, have a parasite right now in your system that's wreaking havoc in your intestinal tract, causing bloating, causing distension, causing inflammation, destroying your intestines, leading to inflammation in your brain, again contributing to brain fog. Folks, these tests are imperative. Some of you need a couple, some of you need quite a few of these tests because you haven't had any of them done. In our office, folks, we leave no stone unturned to find the exact cause of your thyroid problem.